Peace and blessings. Welcome back to the channel once again, where we talk all things health and healing from a holistic perspective, and today will be no different. I'm Dr. Bobby Price, and today we're going to be talking about a condition known as Hidradenitis Suppurativa. It is a chronic skin condition characterized by painful pimples, boils, lesions, abscesses, draining pus that often lead to very noticeable scarring. Now, I'll tell you, I've nicknamed this condition the skin condition from hell, because everybody I've talked to about this condition, while they were talking to me about it, they literally started to either well up tears in their eyes or cry. And people have to deal with this condition for years and sometimes decades, go through multiple lines of treatment with their doctor, and none of it works. And so most recently at an event, I had a young lady who, when I was sitting there talking to some other people after the event was over, just greeting people and saying hello, I noticed as she was walking out, she was just bawling, crying by herself. So I sent my assistant to talk to her and see what was going on. And when she came back, she started to tell me, I have HS. I've had HS since I was 16 years old. Recently got engaged, and I'm afraid to take my clothes off in front of my fiance, and just burst in tears. And so again, it's not only from the standpoint of what it looks like aesthetically. So this is not just about vanity. This is also a very painful condition, and also can be very, very noticeable, and a lot of scarring as well too. So, and again, like I mentioned before, a lot of people go through all of the treatments that they have when they go into their doctor, and they never get any true relief, and they never get any true healing. And so, I thought that this would be really important to have this conversation, because today you're going to hear me talk about hidradenitis suppurativa, or HS, but all the solutions that I'm going to give you, they also apply to people who are struggling with acne, people who are struggling with psoriasis, people who are struggling with any skin conditions, okay? These solutions that I'm gonna give you can also help with that as well too, because quite often they're very, very comparable in terms of, what is causing the problem. It's just the levels are different in terms of severity, okay? So it's just really important, because I was even having a conversation with a young lady who had scalp psoriasis. And what I was explaining to her was, again, what I'm telling you goes for pretty much most skin conditions. And I'll explain why in just a second. And quite often when people come to me, they come to me and they one of the first questions I always ask, well, what have you tried? And they always tell me the same things that most doctors would do. So they go in, the first thing they're going to give you is a cream or ointment, okay? And they're going to slap that cream and ointment on, and maybe give you a little bit of the release, but that's not going to work in most cases, just to be honest with you. The next thing is going to be an antibiotic. But what most people don't understand about antibiotics is that antibiotics not only kill the bad bacteria, they also kill the good bacteria. And you need good bacteria, because we call that good bacteria probiotics, okay, that naturally form in your gut, that make up 90% of your immune system, okay? I'll tell you why that's important in just a second. But quite often, the antibiotics don't work, okay? So then the next step is going to be what's called a biologic, okay? A biologic is a class of drugs. An example would be a drug like Humira. Okay, Humira is what is called a TNF alpha inhibitor. Okay, now what is a TNF alpha inhibitor? TNF alpha, when stimulated, which can be stimulated by many things that we'll talk about in a second, causes inflammation in the body. Well, this is an inhibitor of TNF alpha, so it reduces the inflammation. But also, what people don't understand about biologics, not just Humira, is that, like with Humira, it's required to get a blood test before you get Humira, okay? It's also really important to understand that drugs like Humira, which is used to treat things like rheumatoid arthritis, psoriasis, and other conditions, they suppress your immune system. Okay, going back to what I was talking about with antibiotics. So you just took an antibiotic before you took the biologic Humira, and that antibiotic ruined your gut bacteria, which ruined your immune system essentially. 60 to 70% of your immune system. Some people say as high as 80. Okay? And then on top of that, you follow it up with Humira. Of course, this is going to lead to one of the potential side effects of increasing your risk for all infections. Okay? Every type of infection. It's important to know that even though cancer isn't considered an infection, our immune system is what fights off cancer. That's what keeps you from getting cancer in the first place. And without your immune system, now you're pre-exposing yourself to that. And not only do drugs like Humira cause that side effect, but Humira also causes an increase in bone fractures. Humira could also increase the risk for bumps and nodules in the same areas where you get HS. Okay, so HS is quite often will be found in under the arms, in the armpit, in the groin, on the neck, places of that. And we'll get into why that is in just a second, which is really important. But this drug could actually cause you to have bumps and nodules in the same area where you got the HS, which is what you're trying to treat. But not only that, it could cause muscle weakness. It can cause numbness and tingling. It could also cause issues like dark urine as well too. It could cause confusion. It can cause a rash. It can cause autoimmune reactions as well too, and a host of other things, even heart failure. Okay, this is just one of like at the end of the commercial, when you hear that running off of potential side effects, I just name a few of the potential side effects that this drug can cause. So this is why a lot of people are concerned about going this treatment route. Okay, the creams and ointments typically don't work. The antibiotics, like I told you, will often cause issues in the gut and lead to an increased risk of yeast infections. Women who often take antibiotics have to also take an antifungal on top of that because it can lead to a yeast infection. But it's not just a yeast infection issue in the womb for a woman, but it could be a systemic yeast infection all over the body. Okay, this is why if you get up in the morning and before you brush your teeth, I want you to stick out your tongue and look at your tongue. If it's coated in white, that is yeast. That means you have systemic yeast growth or overgrowth all over your body. All right, and we'll get into how that plays a role in just a second. But what's really important to understand is that, again, that is the typical treatment sort of routine that you're going to go through, okay? And many of you, unfortunately, have already gone through and you're still searching for answers. And so what I want to tell you is that I not only sympathize with you, I empathize with you. So that's why I'm doing today's video. Again, shout out to all of the people that I've talked to about this. This video is dedicated to you and anybody out there who's struggling with this condition, okay? Now, what I'll tell you is before we get into what are the causes and then some of the solutions, things that you need to actually do, I think it's really important to get a wider perspective on why this is happening. Not just the cause, but why this is happening and how your body is actually communicating to you and trying to show you what the issue is. And I think once I say this, it'll make so much sense because you're not going to get this picture or this explanation when you go into your doctor, okay? Now, for those who struggle with HS, one of the things that you'll notice is that where is it located, all right? I know what you're saying, the skin, of course. Yes, it's located on the skin. So that's a sign, okay? That's the first thing. But the second thing is, where specifically on the skin do you typically find these boils, pimples, abscess, lesions? Where do you typically find them? In the armpit, in the groin, under the neck, okay? So these are the places that you typically find them. And so the next question I want you to ask yourself now is that, okay, it's on the skin and it's specifically in these areas. What is going on in these areas? All right? The reason why I'm asking you to ask yourself that is because these areas are where lymph nodes are located, okay? The lymph nodes are part of what's called the lymphatic system. What is the lymphatic system? Your lymphatic system is essentially your sewage system in your body, okay? So the plumbing or the pipes in your home, that is essentially the lymphatic vessels, okay? That is the thing that collects the waste. And then as it is collecting the waste inside of the lymphatic system, which is a little bit different from our plumbing system, it's neutralizing these particular wastes. It's not only the waste you think of in terms of, chemistry, toxicity, but waste in the form of bacteria, viruses, even cancer, okay? Even excess cholesterol, even acidity as well too. Now, put that all in one place. What does it sound like? Mucus, acidity, okay? Cancer, viruses, bacteria. And what does it look like when it's coming out of your skin, that pus or the bumps? Mucus, the ooze and the pus is the infection, okay? So what is this telling you? It's telling you that not only do you have a lymphatic issue, because the bumps are primarily in the areas where the lymph nodes are, which is essentially the toilet stools, where you dump the waste out into the sewage system. Okay? So you got the toilet systems are backed up, and all this mucus is coming out of the toilet. All of this acidity is coming out of the toilets. All of this waste is coming out of the toilets. Now, I want you to put this in perspective for people who have psoriasis, people who have HS, people who have acne, especially severe forms of acne. The reason why it's painful, if you think about what we just talked about, it all makes sense now. If you got acidity coming out through the skin, of course that's going to cause you to not only to be irritated where you want to itch it, but for it to be painful. It's acidic. When you got waste coming out, when you got a lymphatic system that has bacteria, viruses, cancer coming out, of course it's going to lead to potential infection coming out of the skin. Now, what's really important to understand is this. You may be asking yourself, why is it specifically coming out of the skin? Because some of this waste also could be dumped out in other places. Well, the reason why it's coming out specifically through the skin is probably because the other detoxification pathways are clogged up. All right? The liver isn't functioning like it should be because it's probably at a state where it's a fatty liver, where it's a inflamed liver. Okay? So the liver isn't processing these toxins like it should be. All right? What's another detoxification pathway? Your digestive system, bowel movements. Most people are constipated. Most people think having a bowel movement every other day is a normal thing, when you should probably be having a bowel movement for every meal you have. So if you have 2 meals a day, you should have 2 bowel movements. Where's the other waste if you're not having a bowel movement every meal? It's being backed up into the system. Same thing with the kidneys. How many people are you hearing about today who have kidney issues? Okay. Most people who have high blood pressure eventually have kidney issues. Most people who have elevated blood sugar levels have kidney issues. Okay. So the kidney isn't able to get the uric acid out, which we call urine. So it backs up into the system. When it backs up into the system and the kidneys aren't functioning as a detoxification organ, the liver isn't functioning to process these toxins like it should be, the digestive system isn't removing the waste, the body will say, well, can't get rid of it through the bowels, can't get rid of it by processing it through the liver, can't get rid of it by moving the uric acid out through the kidneys. Let's send it out through the skin. Okay? And this is when you see the havoc wreaking, the severe acne, the psoriasis, the hidradenitis suppurativa. This is when you're seeing this, because all of these detoxification pathways are blocked up but more specifically, because you're putting so much waste into the body. And what people don't think about is the skin is not only the largest organ of the body, it's the largest detoxification organ, which means that it's the largest surface area to get rid of toxins. Now, that's not the primary way that the body would like to get rid of it, because the body already has a very specific way it likes to get rid of certain types of toxins. But when these other areas get clogged up, stagnant, and backed up, then the skin becomes the only option. Okay? And you're lucky that it's coming out through the skin, because otherwise, if it's accumulating inside of the body, it's going to not only ruin the tissues, but it's going to ruin your health to a fatal level. So it's just really important to understand that this is the perspective that people need to understand. So when you see these bumps, when you see these boils, when you see these abscesses, the lesions, the scarring, the infection, the pus draining, what you have to think about is the big picture. What is your body trying to say to you? Because there are ways to get things out of the body, and it's not supposed to come out through the skin in that way. If it comes out through the skin, it should come out in a very slow fashion where it's almost unrecognizable. Okay? So it's just really important to understand that perspective before we get started with what the causes are and what those solutions are. But most importantly, you need to understand that you have to heal from the inside out, not from the outside in. So putting things on your skin is not going to heal you, which is why when you look at the typical treatment modalities, this is why they don't work. Putting things on the skin does not correct the issues that are going on inside of the body and the causes, which we'll talk about in the first place. Antibiotics aren't the issue, okay? A lack of antibiotics aren't the issue, okay? And biologics, certainly we do not have a deficiency in biologics like Humira and other drugs. So it's just really important to understand that at the end of the day, you have to heal from the inside out, okay? Which means that these conditions, again, doesn't matter if it's HS, psoriasis, severe acne, doesn't matter what it is. It's telling you that you're putting acidity in the body, you're putting toxicity in the body, you're putting waste in the body, and that is compromising the body's health. That's what it's telling you. And it's compromising the body's ability to remove toxins. All right, so hugely important. If you have that perspective, when you see the boils or the flare-up come, you can immediately think about, what have I been eating this last couple of days? What did I eat? What did I put on my skin? What did I put in my hair? How have I been stressing? You can think about all these things and immediately say, I did this to me. And now you got accountability, but you also have empowerment. Okay, you don't feel like this just happened out of the air. You can control this. You could do something about it. That's the most important thing that I want you guys to understand. This is going to empower you, because when you go into a modern medicine setting, none of these things are going to be addressed. None of these things are going to be talked about. None of these things are going to be considered. You'll just be taking cream, ointment, antibiotic, biologic. Cream, ointment, antibiotic, biologic. Cream, ointment, antibiotic, biologic. You're just going to go back and forth for 1 decade, 2 decades, 3 decades. Trust me, if you've experienced any of this, please put it in the comments so that people understand that, people are going through this. And it's not only does it not feel good, but in my opinion, when you don't look at a patient's lifestyle, what they're eating, when you don't look at the potential causes, in my opinion, that's medical neglect. Okay, so hugely important to understand that you could do something about this, and this is your responsibility. Own it so that you're being empowered. Okay, hugely important. All right, so let's jump into what are the causes. All right, we're going to blaze through these so that you can understand truly what the causes are. Number 1, high insulin levels and blood glucose levels, okay? Blood sugar levels, all right? Elevated blood sugar leads to elevated insulin levels, okay? When your sugar is high in your body, all right, it's gonna cause insulin to be released. This is gonna trigger a cascade of things. But most importantly, it's gonna trigger number two, the number two cause, which is inflammation. But it's also going to trigger mucus production in the body, because that's what happens when your body gets inflamed. To put out the flame, you produce mucus. Okay? To put out the flame, you produce mucus. So sometimes you're producing mucus because you got a lot of inflammation. All right? Same thing with smokers. Like if you smoke cigarettes, which we're going to talk about in a second. All right? You're putting fire into your lungs. Fire into your lungs is going to cause inflammation. To put out the inflammation, your lungs are going to produce mucus. Okay, that's how it goes. So that's why with smokers, they always have a smoker's cough. And they're always rattling because you're putting fire into the lungs, which causes inflammation. Number two. All right. Number three is toxicity. All right. You add when you put toxicity in the body, it has to come out. All right. It's just that simple. If you drink a lot of alcohol, which is a toxin, which is why they say you're intoxicated when you drink too much alcohol. But to be truthful, any form or amount of alcohol is intoxicated. It's not how much, it's any amount. All right. So that's just being honest with you. All right. When that alcohol goes into your body, at a certain point, your body's going to say, hey, you're trying to end my life. And your body is going to rage against you. And that rage is going to look like vomiting. That rage is sometimes looks like you passing you out. It's like, I'm going to take away your consciousness so that you don't drink anymore. Okay? Not only that, your breath, it's not only your breath that smells like alcohol, because now your body's trying to put out alcohol any way it can. Is urinating alcohol, like vomiting alcohol. It's coming out as a gas through your lungs. It's coming out through your skin. This is why when people are intoxicated, you literally can smell the alcohol coming out of them because it's coming out any way it can because it is a toxin. All right? But any form of toxicity, whether it be alcohol or food toxicity, eating ultra-processed foods, eating seed oils, eating these unhealthy foods, eating these things, putting anything toxic in or on your body is going to cause inflammation. Okay? That's only going to make your condition worse. Okay? So what I always tell people is it's really important to understand that you have to address these issues. All right? You got to address the high insulin levels because of the high glucose, which we'll talk about how you do that, the inflammation and the toxicity. All right. So let's get into what that looks like. It's a combination of dieting and detoxing. Let me explain what I mean by that. The number one thing you have to do is you have to go on what's called a low carb diet. Okay. You got to get rid of all the unhealthy carbs. All right. Unhealthy carbs includes, but it's not limited to, all wheat and grains. Okay. White flour, okay? So that's breads, pastas, etc., which most people are in love with, and they're in love with it because of this next one. All right, number two is yeast, okay? But going back to number one real quick, this also includes getting rid of underground provisions as well too. So tubers, anything that grows underground is going to be starchy. Starch turns into sugar in the body, and sugar turns into acid. Okay, sugar and acid is what's going to inflame the bumps, the boils, the lesions, the abscesses, etc. Okay, the draining of the pus is going to exacerbate it. Okay, so you got to get rid of all of those high carb, unhealthy carbs, okay? You got to get rid of yeast, okay? And yeast is not only in bread. to make it grow, okay, and puff up. All right, yeast is also in beer and wine, breads, as I mentioned, but also dried fruits. So don't eat dried fruits during this time because that typically has a lot of yeast on it. Okay, grains typically have a lot of yeast on it because they sit in the factories for months, sometimes years before you get them. So get off the grains. Okay, this includes rice. Number 3, wait, wrong one, bro. Number 2, 3. No dairy. All right, no dairy. All right. In my book, Vegetation Over Medication, I talk about it. The chapter name is Dairy is Scary because people just don't understand how unhealthy dairy is for our body, even though it's so a part of American culture, okay, and Western cultures. But dairy was made for a baby cow. It was not made for you. All right. The same way breast milk is made for a human baby, it's not made for a cow. All right. And the lactose that is in dairy spikes your blood sugar. And as I mentioned before, one of the causes of flare-ups when it comes to HS is when your blood sugar spikes, which spikes your insulin levels. Okay, so you got to get rid of dairy for that reason. But also dairy, the proteins in dairy, casein and whey, are inflammatory. This is why when you have kids who have asthma and you get them off dairy, they start to do so well. They stop producing mucus. They stop having the inflammation so they don't have to use the rescue inhaler all the time. This is why they improve. Okay, so you got to get them off of the dairy, all forms of dairy. Okay, that's number 3. Number 4, get rid of nightshade vegetables. Okay, nightshade vegetables. Many people cannot tolerate nightshade vegetables. Let me give you an example of what nightshade vegetables are. Potatoes in any form. And the unfortunate thing is that 50% of the vegetables that Americans eat, and I would go out on a limb to say even Europeans eat, 50% of the vegetables that they eat is potatoes in some form or fashion, whether it be mashed potatoes or, or French fries. Okay, so getting rid of potatoes, that's a nightshade vegetable. Tomatoes, okay? And I know tomatoes, I love tomatoes, but some people can't tolerate them, and especially people who have issues with HS and other skin issues, you may want to get rid of these nightshades, okay? And I'll tell you how long to do this, all right? So getting rid of the nightshades. Also, if you smoke or vape, you need to get rid of that too, because guess what? Tobacco is a nightshade vegetable, okay? But tobacco causes the inflammation, as I mentioned before. So getting rid of that. And number 5, detox, okay? Now, you have been putting the wrong thing. And I'm not saying it's the wrong thing because I'm saying it's the wrong thing. I'm saying it's the wrong thing because it's coming out through your pores. Yeah, your body is saying it. Your body is saying, I don't want this inside of me, because when you put the right things in it, you don't have that issue. All right. So it's not me saying it's the wrong thing. I'm saying your body is saying it's the wrong thing. And that's obvious. All right. When it's coming out through the skin instead of coming out through other detoxification pathways, which is supposed to come out of. When it starts to come out through your skin, it's saying that all the other ones are backed up. All right. It's saying that this cannot go out through the gut. The gut is already constipated. The gut doesn't like it anyway. The only way I could put it out through the skin. So again, you have been putting the wrong thing in your body. And again, this is according to what your body says. All right? Based on the condition. And you have been doing that for decades, unknowingly. And all of this has accumulated. The acidity has accumulated. The toxicity and the chemistry in the food, all right, that's left behind has accumulated. The pesticides, herbicides, insecticides, which are acidic, have accumulated, all right? All of the mucus from the dairy and what you have grown to love in every form and fashion, whether that be milk, cheese, milk chocolate, ice cream, which is basically the worst thing you could ever eat because ice cream is sugar, dairy, Sugar and dairy and butter, all right? So those three things, you're eating that, and it's not even real butter. Like, that is an absolute nightmare for any skin condition. Ice cream. You have been putting the wrong thing in your body for decades, all right? One of the things that you could do to help this, which is number 5, is help your body by detoxing not only your body, but the detoxification pathways that have become oversaturated, clogged up, and dysfunctional. All right? Once you get these detoxification pathways back online, here's the good thing. All of that waste, mucus, acidity that was going out through the skin now has another way to get out through the body. So this is why detoxification is so important, to get those centers back online. Now your liver is capable of processing those toxins down to a less harmful metabolite. Okay, now that less harmful metabolite can go out through the bowels. Now that your bowels are now open up, because you're using certain herbs, I'll even give you a couple of herbs that you can use. Now your bowels are able to function like they should, especially because you're not putting things in there that would clog up your bowels. And you're using herbs that are actually helping to increase the function of the bowels, to get rid of the waste that has now been impacted and accumulating in the gut, which you now call a gut, a belly, or a fupa. Okay? Now the body is cleaning out the actual kidneys, and now you can get rid of acid in the form of uric acid, also known as urine. So it doesn't have to go out through the skin, so it doesn't have to be painful. Okay? Again, if acid comes out through the skin, there's no way it's not going to be irritating at the least and painful, okay? If it's going out the way it's supposed to go out through the kidneys, then it will be less painful. All right, so that's why detoxification is so important. So some of the herbs that I tell people is really important: burdock root, because burdock root is a blood cleanser, okay? Rhubarb root, because not only is it anti-inflammatory, but it also helps with digestion, okay? Wormwood, which is not only good for parasites, it's also good for, yeast as well too. And as I tell you, the issue with yeast is the fact that yeast makes you love sugar. It makes you crave sugar. The more sugar you eat, higher levels of insulin, higher levels of blood glucose. That leads to more inflammation. That leads to more mucus. So this is why you gotta address the yeast, okay? Because you may get better, but then the yeast, the freaks come out at night. They're gonna make you love that ice cream or whatever it is you eat at night right before you go to bed. All right, so wormwood is important for that reason. Also, this is why oregano is also important for that reason as well too. Herbs like slippery elm and marshmallow root are good for the gut because they almost create this gelatinous-like substance to remove inflammation from the gut. Remove inflammation, you increase function. Increase function, now you can move out the bowels, okay? Now everybody is a herbalist, so all of the herbs that I mentioned are herbs that are in my detox for this very reason. Not specifically for skin conditions, but most of the issues that people are having, it literally starts with their detoxification centers starting to become oversaturated and then becoming dysfunctional, okay? And when you're getting those outside symptoms, which we call HS or psoriasis or scalp psoriasis, which is really yeast coming out through the scalp. That's why it's so itchy, because yeast, when it comes out of anywhere, is going to be itchy, all right? Because yeast creates its own waste, and that waste is acidic, all right? So if yeast comes out through the toes, we call it athlete's foot, okay? If it comes out in the groin, we call it jock itch. If it comes out of the womb, we call it a yeast infection, all right? If it comes out of the scalp psoriasis, it's still yeast, okay? So this is why it's so important. You have to address yeast. And again, That's part of what the parasite candida cleanse and my detox is for, to address these issues, because these issues are common when you look at all these different chronic conditions. So hopefully this has been very eye-opening and helpful. For those who are thinking like, well, what? I'm going to do all of this, Doc, but what can I do to put on the skin? Now, I'll say, be careful if you have open wounds. You don't want to put anything on an open wound. But if it's not an open wound, what I've seen work for people is to use coconut oil with a few drops of tea tree oil, and then you can mix in some aloe, okay? That's a nice little combination, and people will also add in a little bit of turmeric for anti-inflammatory properties as well too. That could be very helpful as well too. So if you're looking to put together a concoction to put on the skin, but I'll tell you, and listen, I know you don't want to hear this, you could put it on the skin all day. If you don't do the things that I talked about before, it is going to be useless. You're going to be in a vicious cycle, the same vicious cycle that you would have if you went through the modern medicine route. Okay, so you got to address the cause. So please share this video, because this video isn't just about HS, it's about any skin condition. Okay, it can help anybody with any skin condition, because most of the symptoms that people are experiencing, okay, this addresses not only the symptoms, but also the cause as well too. Please hit that subscribe button. I need you subscribe to the channel, not just watching the channel, okay? Hit the like button if you love the content and you love the way I kind of give examples. If you hit like, you hit share, it tells me to do more content just like this where I break things down. So that helps me out to grow the channel. That also helps you out in getting the information you need that is very difficult to get from anywhere else, okay, when you go the modern route. All right, so until the next time, peace and blessings and Godspeed.